Hi, I'm Dr. Satish Kumar, and this is Kaizen Dental. Our aim here is to help dentists succeed. In today's Kaizen Dental Success Stories podcast, we have with us Dr. Vidhi Bhanushali. She is the co founder of dentaldost, which is trying to use AI and tele-dentistry to change the way in which patients get their consultations done. Dr. Vidhi Bhanushali is the co-founder and chief dental surgeon at dentaldost, a recipient of Pierre Fauchard International Merit Award and gold medalist in periodontics and preventive dentistry. She's a holistic dentist who believes that everyone should have access to oral health care. She strongly believes that teledentistry is the way to achieve that. That has set her on a 3-year entrepreneurship journey to deliver dentistry to all in a smart way. Dr. Vidhi has spoken at various dental colleges addressing the dental fraternity about dental services and innovations. She is a keen researcher and has papers on recent advances in dentistry. Hi, Dr. Vidhi. Thank you for giving us your time. I can understand it would be extremely tight managing a startup and getting time for all these things. So thank you for coming out here.
Thank you so much. Thank you for having me.
So I wanted to know, we have heard about teleconsulting in general medicine. That's in your normal MBBS kind of line, where patients call you up, tell you their diagnosis, their symptoms and everything. You come up with a diagnosis and you treat them. How did you think of getting teleconsulting into dentistry, where usually dentists are not open to the idea? How did you land up with this idea?
Right. So when initially I had come up with this idea of telehealth in dental domain, I knew it would be difficult, not easy, from both the perspectives, from patients as well and our fraternity as well, the doctors, the dentist part. Because when it comes to telehealth in general medicine, it's very easy because a patient is very vocal about what's happening. He can see his symptoms and express it. I think I'm suffering from temperature or a flu. I've got a rash. What do I do? But when it comes to dental, the patient has only limited knowledge of, I'm having a toothache, I'm not able to sleep. Then that's all. He's not able to describe in a detailed way so that we can understand while we are at a distance, right? Remotely trying to understand, it's difficult. Some patients even cannot express this. They were like, we don't even understand if you have a toothache or it's a gum ache or my tongue is hurting or so on and so forth. So when I thought, I knew it would be challenging, but I could foresee that this is the future since everything is moving in a telehealth way. We should have some base ready so that we are able to give teledentistry. Now, this is pre-COVID when we started in 2018, and thankfully, COVID was a blessing in disguise for us, where it made it possible for everyone to understand that this is the future, especially the dental surgeons, the dental fraternity, and they should accept this new way of delivering dentistry. So it started like, as I had mentioned, right? It started with a blog. We started getting queries, and that was the particular time when we started getting phone calls from the patient, seeing the number of our not helpline at that point of time, but general number that we had for any point of contact, any query, and with a set SOP of questions, asking for photographs of intraoral cavity, or even asking for radiographs or OPGs, IOPs, what the patient already has. It was somewhere possible to, understand what he's saying, relate all these dots, and give a provisional diagnosis ki ye ho sakta hai shayad se, and this is the treatment plan, an approximate treatment plan. I was like, if this is possible with a proper SOP, with proper software, if you have to record everything and maintain a proper follow-up prescription, why don't we give it a full try? And that is when we launched our 24 by 7 helpline in 2019, just giving teledentistry, which was sponsored by us again, because this is a very gray area for patients. They feel like if we are talking to a doctor on phone, he may or may not diagnose right. He may or may not, give us a more detailed treatment plan. Yeah, they're just trying to get some more money out of our pocket. So the whole idea of sponsoring it through ourselves, keeping it free for audience, was so that they feel it's a transparent, unbiased opinion that we are getting 24 by 7, and we can start trusting these guys. And that's what we saw, especially in 2020, after a year of running the helpline. COVID just boomed our reach, and the trust that audience was having with us. And now I can say that it is a very smooth procedure that we have in our internal team of diagnosing, giving a tentative treatment plan, and also explaining prognosis to the patient.
So, have you had any difficulties in the diagnosis procedure, especially if you require radiographs or something of that sort, if the patient doesn't have? How were you able to overcome that difficulty?
Right. Number one difficulty from patient side of diagnosis was to explain them that they have called a helpline and we are here to understand all their symptoms and give them a diagnosis. First thing a patient calls us and asks me, "Aapka clinic kahan par hai? Tell me your address. Tell me if I can get an appointment." We take a step back and we explain them, we are here, we are dentist talking to you, helping you diagnose what's wrong. If you require any prescription right now, you can start medications right away. You need not come to a clinic. And then come to a clinic after 2 to 3 days of your medications when we can actually start with the root canal treatment, extraction, or whatever the treatment line is. That was number one. We overcame that by explaining and having a very good script and process in place so that the patient, whatever language that he's speaking, again, a second problem in the diagnosis, a lot of calls that we get from South India, they are only comfortable in their respective languages, Kannada, Tamil, Telugu, Malayalam, a few from Orissa, so Oriya. So that we overcame by having dental surgeons whose mother tongue are these languages. So whenever we get a call, we would understand what language a patient is comfortable in and route the call to that particular doctor. From North India, whatever calls we've had, they're either comfortable with English or mostly Hindi. So that was not a problem. So combining these two obstacles, first, obviously talking the patient in his language, and second, making him understand that a diagnosis, at least a preliminary, a provisional one, is possible through tele-dentistry. And then he would, we would make him think in such a direction that he's more vocal about what's happening with him or her. So we
Understood.
overcame
But
a major
then,
obstacle from a doctor's perspective was no one is trained. Our syllabus does not train us for tele-dentistry. They had no idea about the sequencing of questions about how to make the person think and be vocal about what's happening with him. So not just the patients, we are even training our internal doctors about how to carry on these procedures and manage two to three things together while they are talking to patient, mentioning down their symptoms, and even if they're asking for a hospital or a clinic nearby, check it simultaneously and let them know. So, and a rigorous internal training is always done for our set of tele-dentists.
understood. So my point is, these dentists are usually on your panel, or you tie up with dental clinics. How does this work?
So the dentist who gives teleconsultation are only through internal team of dentaldost or dental surgeons.
Okay.
Since they speak the same language, the brand language, the sequencing of questions, how to come to a proper conclusion in the right amount of time. A patient won't give more than 10-15 minutes. Less than 3 to 5 minutes is done. बोला अभी मेरे को आगे clinic बता दो. So how to derive maximum information in minimum time and obviously come to a right conclusion is one thing. So we do not extend it to our dental partners to take care of teleconsultation. It's only through the internal team. Once we have done the proper profiling of the patient, his name, general history, medical, dental history, what we have diagnosed and treatment plan, we would be sending the same to our patient and the dental partner, and then refer him to the nearest dentaldost dental partner according to his or her specialty for whatever treatment has been recommended.
Understood. So how do you get dental partners on board? Have you had any protocol, or they directly contact you? Have you gone aggressively and contacted people? How did this work?
So initially, we had a very stringent process. We still have a very stringent process in selecting the dental partner that we want. As I mentioned, we are not a startup that only enlists the dentist around your locality. We do a thorough research on every dentist and only then onboard the dental partner, because we are directly referring the patient to our partner. We are not giving a list of 5 to 10 doctors and then we say, "Aap choose karke chale jao." So there are three main categories through which we thoroughly do a research of a dental surgeon, right from his background, his education, research, contribution to dental literature, to his clinic infrastructure, even small things like, if there is a two-wheeler parking or a four-wheeler parking, if it is a pet friendly, if it is, LGBTQ friendly, what is the waiting period, how is the infrastructure, the sterilization protocol is something we give a lot of weightage on. And third, obviously, is the rapport of the surgeon with us, if he believes in the concept, if he's ready for this disruption in dentistry and a new way of delivering dentistry. So we have like 18 criterias in these three major domains. Once these are checklisted, only then we approach to a dental surgeon and extend partnership program to him. Similarly, since last 3 months now, we've been even getting inquiries from other dental surgeons all across India to be our partner. So when we started, it was just we aggressively getting. Now it's a two-way thing.
Understood. So now these dentists, now if you hire one dentist in an area, okay, there
Yeah.
is a lot of discomfort among dentists is once I join a partner program, what happens if a nearby dentist joins it? So I have
Right.
heard you have a certain set protocol related to it. How does that work?
So this set protocol is dependent upon the city that we are getting. As I mentioned, we are aggressively getting into Pune, Bangalore, and Mumbai. We studied the patient psychology. In Pune, patients are willing to travel around 3 to 3.5 kilometers. So we have made the locality to a radius of 3 to 3.5 kilometers. We would be having only one dental surgeon in that, only one dental
Really good.
partner. For Mumbai, I've seen they don't want to travel more than a kilometer. Saturation of dentists in the city, and obviously the traveling time and otherwise the lifestyle of people. So we've limited to 1 to 1.5 kilometers, one doctor. People don't
Understood.
even want to travel from east to west. It's like we cannot travel. So, and in Bangalore, what we have seen is people are willing to travel if the doctor is good, even till 4 kilometers. So the radius, the circle there is 4 kilometers. So just one partner in that area.
It is really nice that you, being a dentist, have thought about this approach because this is a problem which a lot of dentists who plan to join networks face. So I would like to
Right.
thank you first for putting this in mind before you went ahead. So my next thing is question to you is we know now the dentist get patients and that is how they are benefited. So my question to you is how are you benefited from the entire process? How do you profit from it? Because you told me initially the consulting was done by your end, the
Correct.
management part, the training of the people. So how are you in it for the financial benefit? How does it work out?
Right. So since we are obviously creating a very seamless experience for patients and doctors when they are referred, we have two kind of revenue coming in when it comes to the overall business model. One is from B2C and one is B2B. Now, just to clarify, B2B is just started with the new platform that we are launching. But for dentists, what we do is we charge an annual subscription fees, which is a one-time amount that they pay, number one. And second is a percentage sharing of the entire treatment invoice which is generated. So we usually do not tell dentists to stick to our rates. We are comfortable because depending upon the experience of the doctor, place that he's working, the economics differ. So he can choose whatever rates that he needs to put the approximate range. And when the patient is asking for the treatment range, we would be referring to that list and telling the patient these are the approximate treatment range in your area. And out of the total treatment invoice that is created, we charge a small amount of service fees. So
Understood.
that's how we make revenue.
Okay.
Now that we have made one more technology, which is a pluggable technology, it just not limits our AI to our app, but it can be plugged anywhere through WhatsApp, through Facebook or Instagram chat. So a patient is able to have the same kind of experience no matter what phone software platform he's using or machine. So through
Understood.
that, we have opened up a lot of B2B avenues as well. So we are looking forward to close two deals in pharma companies where we would be the first front face for diagnosis
Great.
for them. Yes.
Great to know that. Now,
Mm.
I know knowing your background, you were a very good student. Okay. You were into practice as well. So you enjoy doing patients, you enjoy dentistry. Still, right now, you have given all that up and you've entered into the startup domain. How do you manage it? Do you miss dentistry? And if you miss dentistry, how do you keep that alive?
Mm. More than missing it, the entire transformation has been a very emotional journey. A roller coaster of not just emotional, but even developing a few social skill sets or my knowledge in financial domain or economics when it comes to the startup economics. Now we understand dental economics, but these two are very different things. So I was not sure if this would work. You're never sure about startup, and I believe if you have a plan B, right, you do not give your 100% to your plan A. If fail ho jayega to plan B hai. So when I started in 2018, obviously I was managing both my practice and dental groups. But the way it grew, when I understood I cannot have, even though you have 24 hours, you can split, you need to have your 100% energy into whatever that you are doing. So in 2019, when we launched the dental helpline, we started setting all the processes, having a proper SOP for everything. I realized that either I have to just continue my dental practice and give up on dental dose, or the vice versa. And I chose to, give up my dental practice and go ahead with the dental dose. The one reason being, I felt this is the future. We need to have some disruptions. And as you just mentioned, if a disruption is to be brought in a dental field, if a dentist bringing in would have a more detailed understanding of the problems, loopholes from both dentist and patient's perspective. Similarly, an engineer won't be able to relate the problem that we face in daily life, or the major things when it comes to managing patients, reducing leads, converting them, and so on and so forth. So that was one thing. Second, I always believed in having some out of the box way in whatever that you're doing, not just profession, but even in my personal life. That kept me going on to pursue something different, something which is crazy, but have a good amount of risks, obviously calculated ones, but something different, and what would make difference in the world. So I hope we are on the same path.
So I want to ask you, the question is, if someone wants to get contact your company and join the network, or join as a internal person as a dentist, or just get into tele-dentistry as such, what would be your suggestion to them?
My suggestion, number one, definitely, this is the future. You need to get into the system in some or the other way. Already people, a lot of dental surgeons have approached us throughout India that we want to get associated with you some or the other way. We do not know how. There are so many resumes that we've received, and when I ask which domain in dental those you want to join, they have no idea, because this is something very different for dentists. Similar question, if we ask to a developer, he would exactly know, I want to work in Python, I want to work in Java, I don't want to do this. But for dentists, it's very difficult to understand. So what I usually recommend, there are two ways: either to be an internal part of dental those, or to be an extended family of dental those, which is the partner network. So if a dentist is practicing and he wants to join the ecosystem of dental groups, get more leads is one thing, but be a part of this ecosystem which is making some difference. Obviously, we have a set procedure, we have a different partner acquisition team, which make the dentist understand everything about how the procedure is. If they want to join the internal team, then again we have three domains in the same. Number one, in the teleconsultation part. Second is in the annotations part, which is taking care of the softwares and the way we are retraining and training our machine learning model. And third is the content part. So we've been making also a lot of content, blogs, videos. We are even coming up with podcasts.
Great.
What I usually do is I give them a tour of all these three domains for a week. And then later, when they understand that this is something which I'm good at and I want to learn more and I can give more and learn more, so we fix their position in that particular department.
So basically, they get to know all the options and then they select based on their interest and their strengths.
Correct, correct.
Great. It's a very nice process.
Thank you.
Before we end, any suggestion to the young dentist as such? Since you have had a roller coaster ride and you've seen everything from dentist
Yes.
as a third eye perspective, what is your advice to the young dentist today?
Keep exploring. Don't give up. I think we are on the same page when it comes to that. Whenever people are taking admission in BDS, they're like, abhi opportunities khatam ho gaya. Dentistry is so saturated. They go back to WHO ratio. India में जितने चाहिए उससे ज़्यादा dentists है. We have a lot of dentists. Only government seats are limited. Government jobs are limited to 9%. Rest 80, 90%, they do not know what to do. Starting our own private practice has become a kind of nightmare, especially after COVID. So dentistry is equal to no future. ऐसा नहीं है. Keep exploring every field you get into. There are a lot of untapped opportunities, and India being so populous, right? It's the best market to try whatever that you want to do. Some people are like, kar denge abroad chale jayenge. Even that, those are very good avenues. But India having so much of cultural changes, populations, different mindsets, languages, habits, lifestyle, A lot of things could be
The
done if I put
entire
some
world wants to come to India, and a lot of Indians want to
correct,
go out.
correct.
I understood.
So keep exploring. Always, listen to your heart if you want to pursue something different. When I started dentistry, there was when I started, I mean, dental those there was some problem at my place, at my in my family. Why don't you practice? It's such a nice field. Start your practice and just concentrate on that. A lot of my fellow colleagues and seniors were criticizing. ये क्या कर रही है इधर प्रैक्टिस करो या कॉलेज ज्वाइन करो considering my background, I was a very studious, and I still love to research and you know uh, contribute to dental literature. A lot of opposition was faced, but if you want to do something, just keep going. जब तक 200% देख के you don't feel like, then this is not worth doing it, I have failed, only then think of maybe I should pivot my path, but don't give up.
It's a really amazing advice to all the young dentists. Explore your options, do not give up, and there'll be something or the other which you will eventually find which you love. Thank you, Dr. Vidhi, for taking out your time from your startup and coming out here. Thanks a lot.
Thank you so much. Thank you. It was wonderful talking to you.
Same here. Thank you.